Yeah, and I'm going to try to do this quickly because I'm being told that we need to finish by 3 so that we save lots of time for discussion. And I'm sure some of these challenges will be self-evident to folks on the call, and I'm sure that they will come up in the Q&A. And I want to preserve time for Wendy to talk about the work that she's doing. So I'll just be very quick here and boil it down, I think, to really sort of 3. There's a list of about 7 points there, but I would boil it down to 3 things. And in doing so, I would acknowledge that I think they all connect to the very deep ways in which public health and health promotion as well have been influenced for many years by the political ideology of neoliberalism. And I know in our chapter, as well as other chapters in the book, they go into a lot of detail about that, so I don't need to get into the gory details of that story. But I'll boil it down to these. The first one, I think, has to do with scale. And this is going to be recognizable to all of us that are in the field of health promotion. The valorization of the individual, whether framed as a patient or a consumer or a client, over that of the community or even society, or more generally the idea of a collective and thinking collectively and working collectively. I think that the tendency to individualize is connected to a tendency to avoid conflict, to reduce social difference into an objective and measurable inequality. The challenge that we have then in the face of that kind of world is to avoid as much as possible the tendency to reduce and to even see difference as a fundamentally democratic virtue, something that we need to engage with, and sometimes we can even celebrate that difference. The second set, I think, have to do with speed, the valorization of competition, that is, the fastest is the best. So sometimes we get caught up in a race against time in the work we do. We see this in the emphasis in our workplaces on productivity, on deliverables, on timelines and budget lines. All of these kinds of things, the speeding up of our work, it comes from somewhere, and it comes at a high cost. And the cost is the loss of the qualitative, the loss of the slow, of the careful, and of course the loss of the relational. And this has to do with this idea of closing up of spaces for shared reflection. The time that we think that we need to take for the careful nurturing of relationships, the making of mistakes and learning from them, allowing for changes of course in what we're trying to do, and defining success in ways that are not necessarily reduced to objective measures, at least in the short term. And then the third one, I think, has to do with size, the valorization of the big over the small. We see this in a lot of different ways, certainly around the rhetoric of big science that tends to prevail over the small case, the anecdotal, the one-size-fits-all policy intervention, which I think is a misreading of what the policy intervention literature would have us do, that over the carefully tailored and closely managed initiatives that can both originate and can remain in the grassroots and for the grassroots. In research, it appears as big budgets, massive programmatic grants given over to big names and big centers, big NGOs. All of this feeds this kind of like culture of size and competition. The best of the best and the brightest of the bright are somehow equates to the biggest. And I think that the loss there is the recognition of the value of small wins, or the value of seeds planted, or the catalytic effect of a few minds that are changed. And so that culture, that neoliberal culture of brute force, rather than one of butterfly effects. So that's my attempt to reduce 7 or 8 points into 3. Back to you, Jane.
Thank you, Jeff. So working in and towards more participation really is what we have to do. Basically, it's a continual challenge, but if we walk our talk as practitioners at every opportunity, set up spaces for dialogue, listen to stories and encourage critical reflection, we can push out those spaces into this bigger picture that you've been talking about. Right, it's over to you, Jeff, to introduce Wendy.